Welcome to Catalyst for Healing. I am here today with a special guest, Charmaine Horn. She just led me in Qigong, and I went to her class earlier this week, and she is an amazing instructor of Qigong, and she's a registered nurse and worked in inpatient psychiatric hospital for 8 years. And so she has a lot of wisdom to share with us about her own experience with mental health, working with patients with mental health, and how she's used Qigong to create a different way of treating mental health. So welcome, Charmaine. I'm so excited to have you.
Oh, thank you so much. I'm so excited to be here, and I love what you're doing with your podcast.
Oh, thank you. So tell us a little bit about yourself. I know I shared just briefly. We got to get relaxed here because we just came off of very relaxing, which, by the way, I'm going to be releasing later this week. She did a short video to demonstrate Qigong for those of you that have never tried it, and it's really easy to follow. But I have to tell you, getting that energy out of my body it's amazing how transformative it is. Just I feel so much more relaxed. And I, as you know, had a full day with clients, and then you came and I was like, oh my gosh, right. And so it really works.
I thought.
Tell us a little bit about how you got into doing Qigong and what your, passion is around that.
Yeah, well, thank you. And yeah, it's like you said, I was working in an inpatient psych unit for 8 years. So it was both adult and geriatric psych. So I was treating patients with bipolar disorder, schizophrenia, also those who had Alzheimer's, Parkinson's. So it was a whole spectrum of psychiatric issues. And just what I realized over time working in the psych unit is the primary treatment we were giving them was medications. And what I saw over time was that when we gave a lot of the patients the meds, I mostly saw, some people did get relief, especially because with acute hospitalization, you want to treat people who are a danger to themselves or others. But over time, a lot of patients kept coming back. The side effects from the meds were really, really harmful. They were causing more health issues over time. And they just didn't seem to be getting better. And I just felt there's something within, a voice within that was just telling me, you know what, I don't know, something here doesn't seem to be working. And then finally in about 2020, a patient came to me and he said he was feeling anxious, and he said, oh, can you come to my room and just play a YouTube video with Tai Chi movements? And I was like, Tai Chi? What's that? So I just looked it up on YouTube. Then I brought the computer in the room, I did the movements with him, and then I was like, wow, I feel calm. And he felt calm too. So that was kind of the beginning of my journey of discovering how movement could actually help a lot with mental health.
Yeah. Mm-hmm. Okay. And what is your personal journey in terms of then from there, how did that lead into Qigong, and how did that impact you personally to build that practice?
Right. It was kind of a long winding road. But so in 2020, I decided to leave my nursing career and I went into my own business. I was actually a life and weight loss coach before Qigong teaching. So I was really into helping people with their mindset and specifically emotional eating. So helping women, especially lose weight by shedding the emotional weight first, basically. But what I realized was with the women that I was coaching, they struggled with being with themselves, being in their body. They were always wanting food to numb themselves, and so it was really hard for them to just sit with those emotions. And no matter how much I coached them on their mind, there was still a disconnect between them and their body. And then for me personally, I had a friend who told me about Qigong. We had taken a mindfulness course together, and I used it for myself because I had a knee injury. Long story. So I had a knee injury. And then over time, I realized how helpful the Qigong was because it reminded me of the Tai Chi video, and it helped me with some issues I was going through too emotionally. Mm-hmm. I had a very, very young niece who passed away in 2022, or sorry, 2023, I believe. But she was only 1 year old. Oh, wow. And so that was kind of my first big loss. And so the Qigong, which unexpectedly helped me process a lot of feelings of grief. It also helped me with burnout and stress. just from navigating my own business, leaving the nursing world. Like there's a whole thing about leaving a secure job and then having your own business. So it just helped me with my own internal struggles and physical struggles. And so I was like, oh, I love this. I wanted to teach that instead.
That's awesome. So how did you start incorporating that into your life? Like, did you start going to classes yourself, or how did you become trained in Qigong?
So nobody really does, like, nobody knows about Qigong really. It's not really known. So there aren't a lot of local practitioners nearby. So YouTube was my big resource at the time. So I was doing a lot of Qigong, like ever since 2022. I kind of made this like promise to myself, like a commitment of I'm going to do Qigong every day. So since 2022, I've been doing Qigong every day. So I would just do short routines on YouTube, and then just like, I don't know, like 10-minute practices every day. And then over time, then eventually I took a course to become an instructor, like a 200-hour instructor, and then now I have like my own practice, but I still do like videos. So, but yeah.
And so Charmaine has some amazing videos on YouTube. If once you see her demonstration, you can transfer over to her videos that she does. But they're really helpful. I mean, like I said, I'm always looking for short bursts of things to like help release energy. Talk about what's behind Qigong. I mean, you talked a lot when I went to your class about Qi and what people probably don't understand the language if they're not part of that culture, right? So maybe you could help educate about what the practice is about.
Right, that's a great
What's the core language? Yeah.
Right, it's like, what is Qigong? So thanks for asking that. So Qigong is an ancient Chinese practice that was practiced thousands and thousands of years ago. So Qi means energy. It means your life force energy. So it's basically energy from within that animates the body, but also energy from the sky, energy from food, energy from colors. So it's just collectively like a term for energy.
Okay.
The root of Chinese medicine, basically like the foundation of Chinese medicine, is based on Qi. So if you look at acupuncture or acupressure or herbal medicine or Qigong, Qigong's a form of Chinese medicine. So they believe that the root cause of pain or illness in the body is because Qi is blocked or stagnant in the body. So what that means is like if you have any tension in the body, which might be caused by stress, negative emotions, trauma, injury, things like that. If you have energy that's sort of blocked and stored in the body and you don't let it flow through the body freely, then over time that could lead to pain and illness, and also just negative mental health issues. So with Qigong, it's a combination of breathing, movement, massage, and also meditation to just help your energy flow. So you learn how to relax the body and just let the energy flow. And when the energy flows freely, according to Chinese medicine, there is no pain.
Yeah, I love that. Yeah. You did a great job describing that.
Oh, thank you. Well, it's a practice thing.
No, I mean, even the tie-in with acupuncture, because that's kind of how it's been described to me with acupuncture, right?
Oh, nice.
So I'm trying to think of, you've incorporated this with patients in IOP programs. So people don't know what that is. It's intensive outpatient treatment. So there's so many wonderful programs now for people where they don't have to go inpatient.
Right.
And they do like, a lot of these places are very integrative in how they're approaching treatment in terms of teaching about nutrition and meditation and breath work and movement. I know, it's exciting. I know. It's
like, it was not like that, like, when
it was not like that when you were in it, probably.
Oh, no, not at all.
I feel like it's very recent. And so what's cool is they'll do an intake, and then I just have a lot of clients that need more support than just the therapy, and they determine based on their symptoms, like whether they can do like 3 half days a week, or there's a huge variety of like, you don't have to go every single day from 9 to 5, but some people need that. And
right.
But anyway, you were teaching this at the outpatient program this last year. So tell me about those experiences with clients. Like, what did you notice?
I know, it's so interesting going from like the hospital setting and then going to an outpatient setting and teaching something like integrative, like Qigong. Honestly, so yeah, in the hospital, it's a different environment. It's a little bit more authoritative. There isn't a whole lot of like we do group activities in the hospital, but I feel like the teaching about coping skills isn't really present. It's more just like, oh, someone's agitated, give them a medicine, give them the PRN right away, give them the Ativan, and you're not really teaching so much because it's so acute. But in the outpatient setting, I was teaching Qigong classes like a few times a week. So I would do a 1 hour Qigong class, and I'd also teach about mindfulness. And what I found was, first of all, the patients were very open and receptive to it. I'm just like,
what? They loved it.
Yeah, I did.
Because I went to the class and I'm like, this is amazing.
No, they really did. Like,
Yeah.
some of them, I mean, some of them weren't quite as open to the practice, especially, sometimes there'll be patients who, especially if they're in an outpatient setting and they don't maybe have as much insight about why they're there, they might not be as open to the practice. But overall, honestly, people really enjoyed it.
Yeah.
I would teach them simple things like one of the things you'll see for the sneak peek for the video is if you massage your chest up and down like this, like you have your hands into loose fists and just knock on your chest, that's a great way to release anxiety. And I remember one of the patients told me that she gets severe anxiety on a plane. And so when she was flying on the plane, she just remembered to do this. And then she said she felt so much better. And I was like, oh my gosh. Like, she said it felt as good as taking a PRN. And I was like, oh, that's like the best compliment anyone could give me.
I mean, yeah, that's amazing.
Yeah.
And again, it's just a short, quick, like, thing you can do.
Right.
To discharge energy.
Right. It's so simple. And there's a lot of evidence too with Qigong. There's a lot of research. They've done a lot of randomized controlled trials with Qigong and Tai Chi that shows that it could be helpful in preventing and treating mental health disorders. But yeah, the patients were really, like at the end of our Qigong classes, they'd feel so relaxed. They'd be like in this sort of like chi state where they're zenned out and they're just like, so they really liked it. And they noticed the shift.
Benefits, yeah. Mm-hmm. What would you say the difference is with Tai Chi and Qigong?
Oh, yes, that's a great question.
I always see Tai Chi in the park. I've never done it, but I'm like, that looks so cool, but they're slower movements, right?
Right,
okay.
Right. So the thing with Tai Chi, Tai Chi is actually a lot younger than Qigong. Tai Chi's about 400 years old. Qigong's like 4,000 years old or so. Okay. So Tai Chi originally started as a martial art form. So the intention of Tai Chi was for combat and fighting. But over time, people started to do slower movements with that form, and it became more meditative. So then over time, it was considered a form of Qigong. Qigong is basically any exercise that combines breathing and slow movement and massage to help you balance your inner harmony and also prevent physical health issues. So Tai Chi became considered part of it. Another thing about Tai Chi is that it's more structured and a little bit more complex. Okay. So there's a lot of standardized movements. The most popular is called the 24 style Yang form. And they're very complex movements with fighting intentions for like striking, defending. It takes a lot of work to remember those movements. It's like doing a dance, like a choreography. While Qigong is more repeated individual movements over and over. So it's more meditative, more healing, more calming.
Yeah, interesting. I just was curious.
Yeah.
Any other last thoughts that you can think of that might be helpful to people that are curious about Qigong? And like you said, starting with the video, it's like there's an easy way you don't have to go search for a class because they are kind of hard to find, right?
Right.
Any other like thing that might motivate someone just to give it a try?
Well, I remember one of my clients, she is a mother of children with autism, and she told me that she has tried other things, like she's tried yoga and regular sitting meditation, but doing Qigong movement was like the only thing that helped her be present in her body. And I would just say, if you want a way to be grounded and centered in the moment, and you find that meditation's maybe not as easy for you, especially if your nervous system's kind of activated and it's hard to sit still, Qigong's a great way like to make it a moving meditation. So that's what it is. It's basically a moving meditation. Okay. So you could be present in your body, present with your breathing, without having to be so stuck in the mind. It gets you kind of out of the mind and into the body.
Yeah.
So honestly, it's a great way to just help you be present without having to sit and meditate for a long time.
Well, I would think, because my clients have a hard time with yoga because it's too still.
Right.
So I would think for the more anxious clients, like this would be a great way to start, because you're doing body movements, but you're also releasing all that stress and tension that is in the body.
Right. I feel like that's a good distinction with yoga, because a lot of the movements in Qigong, or the intention is actually to clear and release and discharge energy.
Yeah.
So I like that it has that intention, whereas a lot of times if you just start with slow movement, that's gonna aggravate people.
Right.
Their nervous system's not ready for that. They're like still having to discharge energy. Yeah, they're wanting to fight and flight. And if you tell them to just slowly move, they're gonna like, want to leave. So, which I've had people leave. So like, you have to learn, okay, discharge the energy first, and then you could go to more meditative state.
Okay. So I think the reason I'm having all these people coming in about integrative approaches is because they are really powerful. And I think in our culture, we're just like, no, we got to go straight to the pharmaceuticals.
Right.
Which again, there's a place for medication, and whether you're mild to moderate or moderate to severe, there's space for that. But there's also new things coming out constantly. But like, not to minimize that, if we're also adding in these integrative practices, like they have a big impact on mood,
right,
and energy, and you notice it right away. And that's the thing that's really cool, is like 10 minutes of Qigong might just calm you down to the point where the rest of your afternoon is really relaxing.
Right.
And so I just want to encourage people to give it a try. Like you said, like 10 minutes of Charmaine, and she's such a good teacher.
Oh my
God, and you will experience some benefit, but stick with it. Like just try to incorporate it even just a day or two a week and see how it makes a difference. So thank you so much for coming. And I really enjoyed just your class and getting to know you and having you on the podcast. So
thank you so much for having me. I just love your mission of spreading awareness of different ways to take care of your mental health, because there are other methods there, and so many other ways to heal. So thank you.
Yeah, you're welcome. All right. Well, we'll see. Stay tuned for her demonstration that we're going to release later this week. And we'll see you next week on Catalyst for Healing. Bye.